Okay, here we go. And as I told the candidates, I'm looking off to the side because my printer isn't working, so I'm reading off my other screen. So welcome candidates and audience members to the candidate forum for the El Camino Healthcare District. I'm today's moderator, Marie Young, with the League of Women Voters, Los Altos Mountain View area, the host for today's event. First, a few housekeeping items. Our forum will last up to 1 hour. Due to the nature of a webinar, we can't provide technical assistance to attendees. All forums will be recorded and available on our elections page tomorrow, the day after this event, at lwvlamv.org and on our YouTube channel, the link for which will be added to the Q&A. I will remain visible on your screen along with our candidates and the timer app. Audience members are not shown, so you can be anonymous, I guess, if you want to be. So, please submit any questions about the league through the Q&A. When answered, it will be visible to all attending. We will not be able to take questions from the audience to the candidates. Chat, therefore, will not be turned on. Questions for candidates have been submitted with registrations. We have combined similar questions to be able to cover as wide a range of topics as possible. And now a little bit of background on both the League of Women Voters and El Camino Health. The League of Women Voters is a nonprofit organization of all genders that promotes informed, active participation in government. We do not support, oppose, or evaluate political candidates or parties, but after careful study, we do take positions on political issues. The League invites anyone who is interested in supporting democracy and local government to join us. And now the El Camino Healthcare District, which covers the cities of Mountain View, Los Altos Hills, most of Sunnyvale, a portion of Cupertino, and we just heard some of Palo Alto, and some unincorporated areas in Santa Clara County. And board members wear 2 hats. They serve as the 5-member elected governing board for the El Camino Healthcare District, which is responsible for establishing, maintaining, operating, or assisting in operating facilities in or outside the district. In addition, they serve on the board of El Camino Health, which oversees the care provided. That board also includes 5 appointed subject matter experts for a total of 10 members. A special tax for maintenance and operations was approved in 1958. The unrestricted portion of those funds supports the public benefit program for both entities. The 2025 benefit is over $11 million, and it is awarded for projects that, quote, expand healthcare across age, education, and income levels, end quote. Voters will choose 3 candidates to serve on the boards. And here's the format for today's forum. Each candidate present will make a 2-minute opening statement. Questions were selected to be relevant to both candidates and to provide useful information to the audience about issues in this race. Depending on the question, responses will be 1 or 2 minutes. There is 1 question with a 2-minute time limit to respond. Finally, the candidates will each have 2 minutes to make a closing statement if they so desire. An electronic timer will display each candidate's remaining time and will display the order of candidates responding to each question, and it's been randomized. We ask our candidates to abide by the following: time limits. When the timer line turns red, I will say thank you. Finish by completing your current sentence. Respect, candidates will not interrupt each other, and fairness, campaign marketing materials will not be visible on the candidate's screen. We have 3 candidates present tonight. A 4th candidate, Lynette Lee Eng, was not able to be here tonight because she had a city council meeting in Los Altos. but has submitted a 2-minute opening statement, which I will now read. Hello, I'm Lynette Lee Eng, and it's a privilege to be a candidate for the El Camino Healthcare District Board. I wish I could be with you in person today, but I'm excited to share my vision for a healthier, more equitable future for our community. With almost 30 years of leadership experience as a Los Altos mayor, council member, and commissioner, along with serving on various regional boards, I've gained a deep understanding of policymaking, budgeting, and fostering community collaboration. My two-term involvement in the Santa Clara Civil Grand Jury has provided me with invaluable insights into government accountability and how to drive effective governance. Our community deserves a healthcare system that sets the standard for excellence, and my commitment is clear. Number one, quality healthcare, ensuring patient-centered, compassionate care while embracing the latest technological advancements. Number two, equity and access, breaking down barriers to care so that no one's socioeconomic status limits their health outcomes. And number three, transparency and accountability, providing clear, accessible information on how resources are spent, ensuring every dollar benefits the community. I will work hand in hand with healthcare professionals, community leaders, and organizations to expand medical facilities, invest in preventive health education, and champion innovative research that brings the best treatment to our residents. I believe that everyone deserves access to high-quality health care. Together, we can create a healthier future for all, and I humbly ask for your support. Learn more about my platform at votelynetteLeeEng.com. Thank you. I will now introduce the candidates who are present tonight alphabetically. They are Julia E. Miller, Dr. Carol Summersill, and John Zoglin. Thank you for participating in today's forum. The order of response to opening statements, questions, and closing statements has been randomized by our electronic timer. So I think, Julia, you're up first for a 2-minute opening statement.
Well, good evening, everyone. As Marie said, I am Julia Miller, and I have been in this area for many years. I'm a retiree from Lockheed Martin and was first in my elective office at the end of the 60s when I was nominated to serve as chairperson of the Lockheed Employees Recreation Association. And then I was also represented the company as Miss Industrial Recreation, so attended many different communities all over the United States. I then am a homeowner in Sunnyvale. I raised my son here. He went to Homestead High for 2 years and then graduated from Bellarmine. I followed my father at Lockheed, and after my retirement from Lockheed, I spent 8 years on the Sunnyvale City Council, also as mayor. After I left the council, I was an alternate to the Santa Clara County Civil Grand Jury. And then I was asked to run for the Healthcare District. During my time on the Healthcare District, I've served on several committees. I was chair of governance, and I'm currently vice chair of compliance and audit. I've served as chair of the Healthcare District and vice chair of the Healthcare District and as secretary treasurer. I also served on the corporate board as secretary treasurer for 7 years. I'm really a policy wonk, as during my time on the city council, I was what's called the regional director. I was on the Cities Association, 8 years on the Bay Area Air Quality Management District, and on the ABAG Executive Board, which, as you know, has representatives, supervisors, mayors, and council members from all 9 Bay Area counties. I love what I do on the Healthcare District, and thank you for listening.
Thank you. Dr. Summersill, you're up next.
Hello. First of all, I'd like to thank the League of Women Voters for inviting me to participate in this forum. I am Dr. Carol Summersill. I am an incumbent director of El Camino Healthcare District, having been first elected 4 years ago. I have deep roots in the community. I have owned a house in Mountain View for 2 decades. And I am the only practicing physician on the Healthcare District Board currently. When I joined the board, I had extensive experience in quality of healthcare, having first started out at a level of OBGYN departments in various hospitals and slowly moved up to what I'm doing now, which I am chair of quality patient care and patient experience for the healthcare district. And as such, our district has won many awards, Leapfrog Grade A and Medicare and Medi-Cal awards. And one example of what we've done under my tenure is we have decreased serious safety events by 70% last year. I also am vice chair of the Healthcare District Board, and as such am involved in the governance of the board. My priorities are to keep this healthcare district owned and operated by the community it serves, maintain the excellent quality, and help coordinate outpatient and inpatient care, thereby decreasing the need for admissions and readmissions. You can learn more about my candidacy and about me at www.carolsomersill.com. Thank you.
Okay, Director Zoglin, you're up next.
Thank you, Marie, and thank everybody for taking the time out of their evening or whenever you're listening to this. Since I joined the board in 2007, I've been a successful champion of increasing accountable, convenient access to the highest quality healthcare services for our community. My unique value add to the board is to guide us and the executive team on focusing on our strategy. Operating in the shadow of Stanford, Kaiser, Sutter, we have to be purposeful to sustain our ability to deliver the top quality of care throughout our community. For our strategy at a board level, it's really 2 simple areas. Why would a patient or a doctor come to El Camino Health versus other options? And what are our organizational goals we need to have in place to ensure we're making progress against that strategy? Our strategy right now is simply to focus on providing the top quality of care conveniently in areas most regularly needed by the community: cancer, heart and vascular, mother and baby, orthopedics. And as we've heard, the success of this strategy is reflected in the overall quality of care El Camino Health is delivering. We're recognized among the top 10% of US hospitals throughout the country. My contributions on the board have come at 3 main inflection points. First, increasing care for underserved populations. In my second meeting in 2007, I asked a question regarding our level of investment in community benefit that led to a tripling of our annual community benefit contributions. Second, delivering strong financials with full accountability. When I was chair of the board, I led an effort to add 25 community members with deep expertise on 6 oversight committees. And third, expanding convenient access to healthcare. Over the past 5 years, we've increased our sites of care 6 times, our doctors 20 times to 200. Again, in the mid-teens, against some resistance, I champion this kind of strategic growth. Thank you.
Thank you, Director Zoglin. Okay, our first question is, please tell us about how the dual board structure serving on the district and hospital boards affects your responsibilities and decision-making. You have 1 minute for this answer.
The benefit of being on both the hospital board and the healthcare district board is the hospital board has the task of overseeing and directing the day-to-day operations, giving strategic advice to the hospital executives. And we have 5 subject matter experts also on that board. The El Camino Healthcare District Board is also involved in making sure that we are addressing the community healthcare needs comprehensively. And so we look more holistically at the community where there are deficits in the community and address those needs. So that is the balance there, to have both the oversight and also the community input. Thank you.
Directors,
Yes, I mean, Carol nicely summarized. Again, on the district level, we can really focus on health of the community, making sure the tax dollars we're receiving, as Marie mentioned, it's also $13 million or so before capital investment. Make sure those are attributed back to the community. We use a triannual county-wide assessment to ensure that we are delivering the services back to the community that are in most need and based on data, not based on personal preferences. And then the separate hospital board, we can partner with the subject matter experts to ensure that we, as the community representatives, and I'd say after a bit of time, we've developed some healthcare expertise, can balance out the needs of the professional healthcare members and the community representative members on the what we call El Camino Health Board. Thank you.
Director Miller, your turn.
Thank you, Marie. I don't want to repeat what my colleagues have already said, but the district board's main responsibility is community benefit distribution, which is based on a small percentage of everybody's property taxes within the district. The corporate board that we also serve on is what I call the working board. That board has 6 committees, and each one of the 5 district board members serve on 2 of those committees. There are 2 additional assignments. My additional assignment is I'm the board liaison to the El Camino Healthcare Foundation, and the other is the El Camino Community Benefits Committee, which I served on for 7 years and turned that over to Dr. Summersill. It's a very effective working arrangement.
Thank you, Director Miller. The next question is, the district and its partner, El Camino Health, have a robust public benefit program. Please talk about the value of this program and highlight a specific grant or project that we should know about. And you have 2 minutes to answer this question.
Well, great. I mean, we introduced this concept in the last question that back almost 15 years ago, we established a very professional group within both the hospital and the district. And so the intent is to ensure that we deliver what the data says we need. Right now, we focus on 3 main areas: access to care, behavioral, mental health, and diabetes. Those 3 categories take about 90% of our funds. And again, these funds are worked together between those of us on the district board elected with our insights into the community and the professional team that sees the data on the incidence of various healthcare challenges within our Los Altos, Mountain View, Sunnyvale communities. Again, we've established very rigorous accountability and transparency. We ensure that all those agencies that receive funds from us have a dashboard, they have measurements, and what I think is most valuable is John Cowan, who's the leader on the team. They work collaboratively with different organizations, whether it's CHAC, those school districts have nursing, used to be called Mayview, now Ravenswood. They work to help improve those. Our intent is not just to give money, but to give expertise to help improve all these organizations that are delivering various types of healthcare. I guess to me, there's maybe the number one is that most of the school districts or nurses are funded through El Camino Community Benefit. And I mean, there's dozens that other people can name, but I think that's particularly valuable to help the students, and the school districts are really strapped in terms of their funds. So we can not only provide the funding, but also the expertise to help the nurses deliver the best care to all the students. Thank you.
Okay, Director Miller.
Yes, our community benefit program is extremely successful. And of course, over the years, it has been tweaked to be the most effective. Have implemented a new process in addition to the issues that Director Zoglin mentioned. We asked for some branding on our contributions. And we've also expanded to some of the most needy organizations in the district can have 2-year funding to save them with staff time in preparing the metrics. For example, Community Services Organization, West Valley Organization, Community Organization, and Sunnyvale Community Service Organization. We give them so they can balance out and budget out for 2 years of funding. And then, of course, as Director Zoglin mentioned, we're a godsend to the schools by providing additional mental health services and school nurses, as well as guidance. It's interesting how that funding comes by. There are 2 pots of money, one under the hospital, which is delineated through, it used to be through a community committee, but now is done through our finance committee. And then the district money, which is the larger pot, about $8 million or more, is done by a community member committee and one member of the board, which rotates. The community members are selected from the surrounding cities where they know the most, where the most need is necessary. If we were to step back from this, our money would go back and be distributed through the remaining special districts. It would not go back to the taxpayer.
Thank you, Director Miller. Dr. Summersill.
Thank you, Director Mill and Director Zoglin, for wonderful summaries of what our community benefits program does. I have the pleasure of being the liaison to the community benefits program through the healthcare district. And this program through the healthcare district gives a little over 8 million to our community partners, and then through the hospital, a little over 3. We have approximately more than 50 programs that we give to, and under my leadership, we started something recently of convening like partners. So within certain of our jurisdictions, there is duplication of services, and so coordination has become important, and we're starting to convene partners. You did ask about highlighting one program, and I'm thinking of the most recent one. So in the past, we had partners come to us for funds, but during the pandemic, there was quite a bit of mental illness among our youth. And as you know, LGBTQ plus youth have 5 times the risk of suicide. And in the youth population, the highest risk of death is accidents followed by suicide. And so our community benefits lead was tasked with finding an organization which could help our youth who are LGBTQ plus. And they found a wonderful organization that is now going out to our schools, and we are funding them, teaching our students on acceptance, less bullying, and what family structures are. And so that's an example of what good the El Camino Healthcare District is doing.
Thank you, Dr. Summersill. Our next question is, what do you see as the greatest challenge facing the district or the hospital in the next 2 years? And you have 1 minute for this question, to respond to this question.
You ready?
Yep.
Thank you, Marie. I was going to say, it looks like I'm up first. Well, that's kind of a difficult question to answer. My colleague, Director Zoglin, inferred that when in his opening statement. We have severe strategic planning going because it's a very complex issue, and healthcare, different healthcares in the area are all competing for the business model. Stanford, Sutter, PAMF, etc. And we as a board are determined to keep the district an independent hospital. We have total confidence in our CEO and executive staff to be watching this on a daily, weekly basis. We are known as the one of the 100th best hospitals in the USA with high-level AAA rating, etc., and strong financial background. We are here to stay.
Thank you, Director Miller. Dr. Summersill.
That's a difficult question to answer in 1 minute, but I'll try. Our main objectives are to stay financially viable and also maintain our excellent quality. With these competing interests, there is a lot of work to be done that we're managing to negotiate between Stanford, Palo Alto Medical Foundation, the independent physicians, and choosing which one's going to lead our programs to get the best quality. So far, we've been able to do this and stay financially viable. But as new hospitals are being built in this area, we have to think outside of the box as far as attracting and maintaining the best physicians in this area. So I think it's exactly what everyone has been talking about, our strategic planning for maintaining our excellence and our financial viability.
Thank you, Dr. Summersill. Director Zoglin.
Yes, our greatest challenge is going to be we are scaling up our outpatient. We recognize as an incredible inpatient healthcare system. In the outpatient, we just have to ensure that the quality of physicians, the quality of nurses, we have an incredible nursing cadre within our hospitals, those and the culture. Again, one of the great successes of the culture of the hospital has been the culture we've established, which is a partnership between physicians and nurses. And we need to ensure as we grow, this is like any organization in Silicon Valley, as we grow and scale this outpatient to increase the convenient access to care for underserved and for others, is to ensure that that quality of delivery and the patient-centeredness, if I can almost make up a word, that we focus on at the hospital is extended throughout the district and the county. Thank you.
Thank you, Director Zoglin. Okay, you alluded to this in your response, Director Zoglin. The district has expanded dramatically from 3 to over 15 sites, now providing care in much of Santa Clara County. Do you think there's a need for further expansion? If so, what would you like to see? If not, why? And you have 1 minute for this question. Dr. Summersill.
Our payment model in the United States is dependent on expansion. With more market share, the rates are improved through insurances and others. And so, yes, we will need to expand, but within this healthcare district, one of the nice things of having the electeds oversee everything is making sure that as we expand, that the needs of this community are utmost as we have to expand for financial viability. And with this expansion, we hope to coordinate better the outpatient and the inpatient so that there is less admissions and readmissions. But yes, we will have to expand to remain viable.
Director Zoglin.
Yes, I mean, the expansion, great, completely agree. We need to continue to expand. Urgent care is one area, just patient experience and what people expect living with Amazon these days is much greater convenience to care is one of the reasons we need to grow. It's not just for the patients, it's also for the doctors. You know, we've been able to support a number of independent physicians we're top quality, but need to be able to have bigger catchment area to bring in patients from throughout the county to support their business. And this is a way we can keep these top quality physicians, been trained at Stanford and UCSF. We're the beneficiary of two great schools, and then have the very best physicians want to be operating in the community in real life care as opposed to maybe an academic medical center. Thank you.
Thank you. Director Miller.
There's not a lot for me to add after my two colleagues very clearly articulated the need to growth to stay competitive. During our patient and community surveys, our feedback is always that we are better than Stanford, better than our competition, but we do have to, we have grown during the time that I've been on the board. We are now like an El Camino health system. We used to have 12 clinics. Now we have 14 clinics or 2 additional accessory surgery centers. So yes, we will be growing to maintain our competitiveness and expanding our geographic reach. I don't really have anything to add other than we will continue to keep improving and extending our care to the community that we serve.
Thank you, Director Miller. Okay, so we're on to question number 6. What methods do you use to keep current with the needs of your geographically, ethnically, and economically diverse communities? And it's Director Zoglin is up first.
Yes, I mean, I think there are so many great community organizations. So one is just spending time with all of those, asking what they're hearing out there. I'm a member of the Sunnyvale Rotary. So I think just, living the life, being a citizen, being out there, attending, city events, school events. My daughter's just finished high school a year or two ago. And, just living the life with these people is the best way to learn. Some are more, frankly, in my socioeconomic area. And again, others is how we meet people. I spent a lot of time in Sunnyvale Community Services, Mayview, when Ken Graham, our previous CEO at El Camino, had been the head of that. So it's just a matter of really investing the time in getting out of your bubble to speak with people where they live.
Thank you, Director Zoglin. Director Miller.
Well, I've been in Sunnyvale for many years and I've seen it change. My condo was built on an apricot orchard. I'm still very much involved with the city of Sunnyvale and participate in their cultural activities. So I'm very much aware of how things have changed over the years. It's very exciting, actually, to see all the different cultures come in. I think Sunnyvale Community Services is having a Diwali exhibit next Saturday at the community center. Last Saturday, they had the first Filipino exhibit. I mean, that's what we are. That's what the Valley is. That's why all the different engineers come to promote our technology and contribute to California being the 5th economic engine in the world.
Thank you, Director Miller. Dr. Summersell.
Hello. So as the chair of the Quality Patient Care and Patient Experience Committee, we have several metrics that we meet, and we follow the STEEP dashboard, which is safe, timely, effective, efficient, equitable, and patient-centered care. In some of the metrics that were not being met that dealt with equitable care, what I tasked our medical staff with doing is in each department to find a metric that they're not meeting and find out how to address it from an equity standpoint. And we have had some wonderful work come out of that. We were not a baby-friendly hospital, but the OBGYN department determined that the breastfeeding rates were low in certain ethnic populations. And we hired a nurse who speaks Mandarin to help with that population, and now the breastfeeding rates are much better. So the way I stay connected is by listening to the staff, listening to the members. We also hired a population health expert to teach all of us board members. Thank you.
Thank you. Okay, how would you characterize the financial health of the district? Director,
Thank you, Marie. That's the easiest question. We are totally solid financially. A little bit proprietary information, but I can safely say that we have probably cash reserves to survive for a year, 12 months. We did not have any layoffs during the pandemic. Management was very strategic, as we have 2 hospitals. All the pandemic cases, COVID cases were in one hospital, and all the auxiliary surgeries, et cetera, were done in our other facility. Excellent planning. We partnered with the 129th Air Rescue Wing, set up command centers. Again, community helping community, and everything was highly successful. Totally solid financially and workplace.
thank you so much, Director Miller. Dr. Summersill, what can you add to that?
Wonderful summary, Director Miller. We are doing well financially, and much of that has to do with our CFO, who is looking in every nook and cranny for ways to improve, and without skimping on quality. Also, it has to do with our essential workers. Many of them partnered with us to find creative solutions during the pandemic, which have saved us quite a bit of money. So we have a lot of reserves, but we still have a long way to go as far as community benefits, allocation of dollars, and we have no problem meeting our needs. Thank you.
Thank you, Dr. Summersill. Director Zoglin.
Yes, one of the areas I'm most proud about is our pension, which is significantly overfunded, as we read headlines around the country of massively underfunded pensions and the impact those are going to make on our local budgets. Yes, we have a tremendous CFO that does a great job of tying our budget process into our strategy. When I was the chair of the Finance Committee, I helped work on that process together so that we can have the executive team lead the operational goal, but ensure that we've got a conversation back and forth strategically with the board and with our long-term vision so that we're ensure that the money we have will last. Also, as chair of the investment committee, I ensured that we migrated to a best practices investment so that our large portfolio has been able to take advantage of the stock market gains over the past 15 years by ensuring that we are appropriately, without too much risk, invested in multiple different financial vehicles. Thank you.
Thank you. Okay, please ask and answer a question you wish we had asked you. Dr. Summersill, you're up first.
With no time to think about it. Okay. Why are you running? And the answer to why I'm running is because I get a tremendous amount of joy out of seeing that I can have an ability to really impact the health of the community in my little way by being director of this healthcare district. I get a tremendous amount of joy in seeing us reach heights that are much well above academic centers in our quality. I get a tremendous amount of joy in working with my colleagues to find solutions to some of these problems. And it really has increased my feelings of connectedness to this community. Thank you.
Thank you. Director Miller.
I can't think of a question per se, but I like what Dr. Summersill said. I mean, thank you for having this so we can express our experience and why we do this job. It's quite intense and it's quite complex. I had thought I was going to retire, and I spent about 3 months looking to see if someone wanted to take my seat, and they didn't. So I guess I was a little greedy, as the three of us were incumbents and were unopposed, because I love what I do and I feel like I have made a significant difference in several different areas. Like was mentioned earlier, it's nice to have a balance with community members connected to the community. I've been able to use some of my friendships to bring in significant amount of dollars to the hospital and the foundation. And Dr. Summersill has her expertise in quality. It's really a good place to make a difference. And I'm happy to serve.
Thank you, Director Miller. Director Zoglin.
Yeah, the question I would ask is, when there's 75 district hospitals around the state of California, why can you count the number on a single hand that are still operating successfully? And I'd say the two questions. One is the quality of our doctors and our nurses and the culture we have established. But the other, when I go to different American Hospital Association, different venues where there are experts in hospitals and healthcare systems, the question I ask, why, they tell me people give up because the board gets tired. The board won't engage with the executives, with the community, and help ensure that the voice of the community is reflected properly throughout the institution. So I think what you've heard tonight is a number of people that have that passion to continue to have this local institution be managed, focused institutionally, so we can reinvest those dollars from our community back into the health of the entire district. Thank you.
Thank you. Okay, I'm going to go back to our first question, which was, you're all experienced board members. What strengths, qualities, and experience do you draw on to be most effective in this role? And you all have 1 minute to answer this question.
Well, I think my experiences comes from serving as mayor in Sunnyvale, the second largest city in the county, and my regional experience. I also served for 3 years on the Association of California Healthcare Districts, as Director Zoglin mentioned about there being 73 other healthcare districts, but none are of the quality of El Camino Hospital. So that was an easy for me to teach other hospital districts about our best practices, so to speak, and share experiences. I just think we all work well together. We have a fantastic executive staff. We have strong finances, and we care about our community. And we make sure that we keep tweaking that to do better each year. And public service has just been part of me for many, many years. I love serving my community.
Thank you, Director Miller. Dr. Summersill.
Would you repeat the question, please?
Sure. You're all experienced board members. What strengths, qualities, and experience do you draw on to be most effective in this role?
So my strengths that I draw on are the ability to really listen, and the qualities I draw on are my experience as an essential worker within this healthcare district and also being director. So I'm able to bridge that gap between all members within the healthcare district, so all voices are heard. We recently had an initiative to become a high reliability organization and create a culture of safety. And we really have worked toward that tremendously, such that really most of our workers would not want to work anywhere else. So I think I bring my healthcare quality expertise to the table, and also bridging the gap between the essential workers and the board. Thank you.
Thank you. Director Zoglin.
Yes, I mentioned my experience in industry, where you need to collaborate. I've worked both in startups, but large companies like IBM, where you're going to get nothing done unless you can work with other people. My ability to work with the board, with the executive team, with all the employees at the hospital, and I think equally importantly, other publicly elected local officials. We match very closely with Sunnyvale, Mountain View, Los Altos, all the school districts. I've mentioned, my strategic background and expertise, I think, has really guided us into this century in terms of thinking strategically rather than tactically. And then finally, my expertise just in governance helped us expand to this broader role, which again, I bring from industry. Our goal is to ensure we have the right processes in place for the care delivery that we need to have. Obviously, we're not delivering the care. We need to create the best environment for that top quality care delivery.
Thank you, Director Zoglin. And that concludes our forum. I'd like to thank the candidates for participating and the volunteers who have made this forum possible. The League of Women Voters believes that a democratic government depends upon the informed and active participation of its citizens, and we hope that the insights you have gained from this forum will help in planning your vote. To look at a personalized ballot with information about your candidates and ballot initiatives, please visit the Vote 411 website at www.vote411, no spaces between vote and 411.org. Just enter your address to see your ballot choices, candidate statements, and information, as well as the propositions. When this forum closes, our webpage, the League of Women Voters, will appear. Visit our webpage to see our election events and links to recordings of those that have already occurred, which is everything except this one. And again, that will be up by tomorrow, I think, or shortly thereafter. You need to click on candidate forums to get to the appropriate place to see the recordings. For the November 5th election, please vote early and deposit your signed ballot in a ballot drop box or mailbox as soon as possible. Thank you for helping make our democracy work. We appreciate all of you. Thank you for coming.
Thank you. Good night.
Good night.
Good night, and thank
everybody.
you.